The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, Dr. Tom Roselle here, and we have another episode of Ageless Health with yours truly. We're going to get into a little bit about the heart today, your heart on sugar. So that's kind of interesting, right? Because so many of you have a sweet tooth, and that's going to be, kind of a lead in to the program that we're having on the 21st of this month, coming up at the Roselle Center for Healing. And those of you who have been to the sessions in-house before know that we really get deep into the effects of what it is that we're talking about. This time it happens to be public enemy number one, sugar consumption, or is sugar still public enemy number one? If you've been listening to the episodes over the last few weeks, you know that this is a really problematic situation potentially. A little bit of sugar goes a long way. If you really understand what happens and know that particularly processed sugars of any kind, unnatural sugars of any kind, steal and deplete the body of very essential resources. And what we're talking about is we're talking about how the body goes into a high level of inflammatory response, causing all kinds of damage within the system. We started out a couple of weeks ago. We told you about, how if you put sugar in a saucepan and you put under really low heat, it becomes caramelized. And that's what happens in your body. It starts sticking to things. And that's an excess. Your body can burn certain amounts of sugar, but if you overdo it, it begins to cause deterioration, degeneration, inflammatory responses, and even can lead to what we're going to talk about today, cardiovascular damage and cardiovascular disease. So pay attention as we go through this. We're going to probably make it succinct, but I want to invite you to the Roselle Center for Healing in Fairfax on the 21st, Wednesday at 6 p.m. Join us. Join me and Dr. Scott Lamp, and we're really going to get into this in depth, and we're going to show you the pain patterns, the headaches, the inflammatory reactions, the potential for cancers, all these things because of your sweet tooth. That I got to have some more of this stuff. I have patients, unfortunately, that live on sugar all day long. They go to work, they grab a Coke or two in the morning, they have a candy bar, they have supposedly these protein bars that they eat. But if you look at the side panel, it's really nothing but fast-acting carbohydrates with a little bit of amino acid in it, and it's doing more damage than good. So over a period of time, you start seeing blood sugars start to go up, inflammatory markers go up, damage, osteoporosis, loss of calcium within the bone mass, and consequently, you're in pain, you hurt, your diabetic, threshold starts getting a little closer and closer and closer, and you wonder why. And then your doctor says, well, we're going to put you on Ozempic, or we're going to put you on something else. Listen, you don't have to get to that place, because by the time you get to that place and diabetes is already set in, your kidneys, your eyes, your brain, your nervous system is already affected. But let's talk about the heart today, and let's talk about what you can do to prevent the damage. But please join us. Register at drtomroselle.com, and any of your social media sites. By the way, we're all over the place. From Facebook to Instagram to X and so forth. You'll find us and follow us, and then you'll be aware of everything that we're doing and what you can do to better yourself and take care of your families. So let's get going. Let's talk about this crazy situation called your heart on sugar, if you will. So does sugar, let's start with basics. Does sugar increase your risk of heart disease by raising blood pressure and promoting chronic inflammatory reaction? And that thing called triglycerides, when your doctor sends you out and gets the test done, your total cholesterol and your HDLs and LDLs and triglycerides? The short answer is, without doubt, absolutely, positively, yes. One of my favorite sites when it comes to the heart is to go to the Cleveland Clinic Health Essentials page, and you start looking, at some of the things that because they're really the leader in research when it comes to treating patients with all kinds of heart disease. But, think about it. We like our sweets, right? We go out for dinner and we said, well, I'm going to have just a little bit. And we're going to have that creme brulee. We're going to have chocolate mousse. We're going to have tiramisu. We're going to have a little bit of ice cream or the jams that we put on. Oh, the jam, right? So we put it on our toast and so forth, and we don't think it's anything, but we forgot that the bread underneath it also converts into sugar. And then we have pancakes on top of that. And then we have, how does that lead into, oh my God, my heart is in a problem. I have heart disease. Well, excess sugar, and we're going to talk about what that means in a minute, can increase the risk of heart disease directly and indirectly. And when you understand that, you have to take advantage of the knowledge and apply it to you, unless you want to walk around one of these days and all of a sudden you get this big old stabbing pain in your chest and you're not here anymore. I don't know about you, but you know what? I got to figure out how to stick around on the planet a little longer, and I want to share that information with you. I want you to be able to be here a long time. So sugar affects your heart in a lot of different ways, and it comes down to fat distribution and so forth. We can want to use the term cholesterol. Well, yes and no. Cholesterol has multidimensional things. Cholesterol is good for you. You need it to protect you. And let me give you a statistic on cholesterol. Your doctor wants to drop the cholesterol, but if you go into all the research papers, you go into PubMed, you go into Nature, you go into the Townsend Letter, you go into the Cleveland Clinic, and really look at everything, you're going to see that cholesterol itself, the accumulation of cholesterol, adds about 0.5%. That's 0.5% in cardiovascular plaquing and disease. And yet they want to drop it down. They want that cholesterol to go down as low as they can get it. The unfortunate part about it is that the guys that are pushing this narrative are the drug companies. And they're the ones that sell the statins, and they're the ones that sell the other stuff. The problem is that's not it. But let's talk about what it really is and why these things are problematic. Now, you've heard about HDLs, the good cholesterol, and you've heard about LDLs, the bad cholesterol, right? Well, that's just the beginning of the top thing. The reason why LDL is so bad, providing it's the really bad LDL, is because it causes clogging and plaquing within the arterial vessels and within the heart. But there are many things that cause it. Sugar can be one of them. But remember, LDL simply means low density lipotrophic factors. Now, there's an LDL A, there's an LDL small a, there's an LDL big B, and they mean different types of things. But we're going to leave it at that because we could be here for a couple hours. But I want to tune you in and then let you know what can be done. So on your blood test, there's this other thing called triglycerides. Now, triglycerides, and I'll tell patients that visualize triglycerides as this heavy sludge, and it's like mud flowing through your arteries. Doesn't necessarily plaque, but it dramatically increases your risk for heart disease if it's too high. It's a type of fat in your body that kind of pulls other things in and locks them in place and so forth. So you want to get this mud, this sludge out. But you know what it's directly related to? High sugar diets, or diets of high carbohydrates and alcohol, by the way, that will convert into sugar very rapidly. So when a patient comes in and I see triglyceride levels elevated, and by the way, your physician, your traditional doc, wants to see your triglycerides under 150, 149 or less. You come into me and I'm going to say, I want to see that between 150, not lower than 50, because that has a problem by itself. But I want to get that down so that blood is flowing cleanly and there's not a lot of issues of accumulation. So we'll talk about that different. That's functional medicine pathways. And on the 21st, I will get into that and I'll tell you why that's so important from, what the if you will, the drug companies are trying to tell you. But you want that triglyceride lower. And the good news is that you don't need them to drop that down. There's a lot of things you can do to make a difference. But a lot of pain and soreness and pressures and blood pressure and so forth. It's all related. Blood pressure. Uh, when we talk about that, what causes blood pressure? Well, one of the things is when you get high amounts of sugar in your diet, it contributes significantly to high blood pressure and increases your risk, obviously, of cardiovascular disease. But you have a choice, right? You can go around and do all the drug things to drop your blood pressure down. You can do all of the natural things, which, niacin works, and certain types of magnesium and potassium and vasodilators and so forth in the natural world. Or you can quit eating the sugar and go for a walk every day and make sure it's every day. You make that as part of your lifestyle and you work everything around it. As a society, we have become less adaptive, if you will. So I can't do this, I have this. We're getting too scattered, too fragmented, and forgetting about taking care of ourselves. And you've heard me say 1,000 times, when I go to Europe and I teach over there, and I look at people and I say, they don't look like Americans do. Even Canada, by the way, they don't look like Americans do. Why? Because they don't eat the way that we eat. They don't have the same type of garbage, if you will, within our foods that we have here in this country, supported by the fact that in the EU particularly, they don't allow a lot of American foods to be imported into those countries because they know they're damaging. There's a problem with them. So when we look at sugar and diets that are really heavy in sugar, and we said, remember, 160 pounds per person per year, it's a lot of sugar. And contributing. So inflammatory pathways within the body, anything that will swell is enhanced by a sugar-rich diet. Okay, so now we're really breaking it down into understandable terms here. So when you have this high levels of inflammation to begin with because of injury, because of stress patterns, and now you add a sugar-rich diet to it because you need to have that feel-good situation. What you've done is you've increased the risk of heart disease and cardiovascular disease exponentially. And you're looking at basically Russian roulette. That revolver at some point is going to hit that chamber with the bullet in it, and you're going to take yourself out. It's just the way it is. It's straight up. So sugar can cause excess of weight, obviously, which is a problem on the heart because now you got to carry around all this extra stuff. But the risk of diabetes and high blood pressure and all of that contributing to developing heart disease is exponentially through the ceiling. So what do you got to do? You got to cut back on the stuff, right? You got to knock it off. Cutting back in sugar can take some effort because you're addicted. The manufacturers out there know that you're addicted to sugar, and the more sugar they put in their foods, if you look at the side panel, the more that you're going to crave their foods over somebody else's food, so they can keep loading it up. So the American Heart Association, which I really don't like to quote often, says no more than about 6 teaspoons or 100 calories of added sugar for women and about 9 teaspoons per men. I don't even like that level. It's like, look, we talked about what happens when you heat sugar. I don't care if it's 6 teaspoons or, it's a full cup. It's going to do the same thing. If you're doing it on a regular basis, it's the consistency. Can everybody, go out and say, I'm going out and have this amazing flourless chocolate cake tonight, and I'm going to blow it off. Yeah, and you're going to feel like somebody drugged you the next day. But if you don't do it again and you go for a walk and you do the things that you normally do and you eat really well, your body will begin to recover and not do the damage that it's supposed to, that it could do otherwise. So, the sugar sweetened beverages. And remember I said that even artificial sugars, the body recognizes as sugar and it's going to act accordingly. And what do I mean by that? I mean that you're going to start taking chromium. You're going to start out of your system. You're going to start using up vitamin B complexes and vitamin C. You start burning it because this is how the body survives. And so when we're drinking all these sugary sweet drinks, whether juices, by the way, we talked about how damaging, drinking juices every day. We don't drink a little bit of juice. Back in the day, the juice in the morning was only about 4 ounces like this. And now we're drinking juices like this, and maybe we'll drink it all day long. And, even when my children were young, we'd give them a little bit of apple juice, but it was watered down. It was half and half. We didn't give them the whole thing because we knew there was a problem and we didn't do it all the time. So even the American Heart Association said consuming 12 ounces of any kind of sugary drink multiplies, increases, dramatically raises triglycerides and lowers your good cholesterol, your HDLs. Do you hear what I just said? That consuming 12 ounces of any sugary drink multiplies the risk of increasing your triglycerides and lowering the good cholesterols that your body needs to survive. Now, one can of, and this is a direct thing, one can of soda, you can have more than the daily recommended, sugars. And again, we're saying what, 6 teaspoons for women, 9 teaspoons for guys. And I just told you that I don't necessarily support that, but let's go with that. The number one thing you should never do to lower your sugar intake is don't drink your sugar, okay? Because it's loaded. A can of soda has got like 12 to 13 teaspoons of sugar in it, depends on the company. And then the unnatural sugars, if you will, the artificial sugars, are even worse because they cause all kinds of other damages and neurological degeneration and the like. So when you're looking at these things and you're looking at added sugars, you got to know what their names are, right? So agave is a sugar. Barley malt is a sugar. Cane juice is a sugar. Corn syrup, dextrose, fructose, maltose, sucrose, molasses, rice syrup. They're all sugars. And don't think just because you're not putting that, the white stuff in or the brown stuff in or whatever it is, the natural sugars, that you're okay. You're not. And so you start backing off. So what do you do? Instead of putting sweeteners on your oatmeal and your buckwheat and so forth, why don't you put some berries in there? Okay, that's a good way to step out. Put some berries in, and start backing it off a little bit of time. Afternoons when people go down the tubes, meaning they get really tired, the energy's gone. What do? They reach for a candy bar and a soda. Well, that's going to knock your immunological system right down to its knees. It's going to put you on the other side. You want to go to sleep. You need more and more of it. Now you're looking for the caffeine and the sugar on top of it. So if that's the case, don't you think it'd be better if you shift and you change your ways? Or do you like the cardiovascular potential? Do you like the stroke potential? Do you like the degeneration that comes about with years of subtle, slow injury that causes now an increased risk of inflammatory degeneration? Not all sugars are created equal, right? Natural sugars found in foods like milk and fruit can be a small part of your diet. And I say small part, not something that you're doing, not, particularly the way our foods are processed today. But you want to watch for anything that goes inside of that as well. Added sugars obviously include what we've talked about, maple syrup even, and sugar and honey and so forth that you put into your coffee. Well, I just put a little bit of sugar in my coffee. I put a little sugar in my tea. Yeah, a little bit of sugar to you is like a tablespoon. And how many of those do you have throughout the day? They start adding up. Do the math. You're going to find that it says, oh my God, I didn't realize that. So those cookies, that afternoon thing. But what I want you to start focusing on is your heart. And because these guys are going to increase your risk. So when you're starting to see, you're getting a little pressure in your chest, a little chest pain, right? May not even be there all the time, just might be there on occasion. That could be vasospasm and it's not working the way it's supposed to. Sure, it could be magnesium problems. It could be potassium. It could be CoQ10 is insufficient. It could be a little bit of problem with a fight-flight reaction, so you're getting coronary spasm. And that's something that on the Wednesday night, the 21st, we're going to talk about that. I'm going to teach you what can be done to eliminate it totally, completely. That pain you get in your shoulder that you ignore, just think it's you're stiff and tight. It might be your heart, and it might be you're perpetuated because you're eating all kinds of garbage, my friends. So how about that chest pain? How about the blood pressure that just kind of starts sneaking up a little bit? Because what? You're sitting on your butt all the time. You're getting this paid for round thing around your waistline, and you don't get any exercise, and that blood pressure is starting to sneak up. I talked about tiredness, after eating sugar or any carbohydrates, fast-acting carbohydrate. What happens if, you want to go to sleep all the time after you eat a carbohydrate meal, or you get a little bit of sugar and you're forcing yourself to eat more and more of it because it bumps you up and then it bumps you down, it bumps you up and then it bumps you down. That's called be very careful, because your heart is also being suspect to what you're doing. The increased sugar cravings. So what will you eat? Okay. How can you change your habit? First of all, you have to love yourself and your heart more than what you've been doing, and understand that you're playing with that Russian roulette revolver. And at some point, you're going to hit that chamber. And if you're really lucky, it'll be one and done and you're out. But what happens if it's not one and done? What happens if now you're going to get, you have to go in for a stent, God forbid, open heart surgery. And all of that could have been prevented. All of that could have been, something that you could have lived a much healthier life. So we have to make sure that we understand that that sweet tooth that we have, that sugar that we crave all the time, that quick acting energy drink that we're grabbing is something that is cumulative over a period of time and increases your risk for heart disease, stroke, type 2 diabetes, that unfortunately in this country, millions and millions of people are suffering from. Eating too much sugar, okay, sets off a reaction that causes coronary problems. It causes pancreatic problems, causing diabetic problems. And remember what happens with diabetes, right? It affects your heart and it affects your circulatory pattern. And it will cause you at some point, if it gets out of control, to lose parts of your body, your toes, maybe even your leg. Now, I don't know about you, but that's not the way I want to spend the rest of my life. I want to make sure that I can do what I need to do to help me and continue the process and live another 30 years and continue to support and help as many people as I possibly can. Sugar is deadly. Make sure you understand that. You can reverse it, and it's not just by adding tons of nutritional supplementations. A little bit of sugar is not a bad thing, but it has to be natural sugars. Things like what? It has to be something like, a little bit of raw honey. It has to be a little bit of, the the dates that you eat. It has to be a little bit of fig. It has to be something like that, but a little bit, gentle, small amounts, not a lot of anything. I hope this doesn't scare you. I hope it makes a difference. There's a lot of things that we're going to teach you about on the 21st at the Roselle Center for Healing. So please make sure you join us. Make sure that you understand that you're really in control of your life. Health is a do-it-yourself program. And we want to give you the tools to optimize your longevity, what you do on this planet on a day-to-day basis. You have a great time. And remember, I'm here for one reason. I love you all. You deserve the information. Have a great day. Bye.